Question 1. Research into the process of understanding and addressing medical bills for a client reveals several potential strategies. Which of the following approaches best aligns with the professional responsibilities of an accredited financial counselor focusing on healthcare, adhering to U.S. regulatory frameworks and ethical guidelines? Option A. Inform the client that medical bills are complex and often contain errors, and that their primary focus should be on paying the total amount due as quickly as possible to avoid collections. Option B. Suggest the client ignore the medical bill if their insurance has already processed a claim, as the insurer should have caught any errors. Option C. Advise the client to meticulously compare each line item on the medical bill with their insurance explanation of benefits, EOB, and medical records to identify any discrepancies or potential errors before considering payment or dispute. Option D. Recommend that the client immediately dispute every charge on the medical bill, regardless of its apparent accuracy, to ensure no overpayment occurs. The correct answer is C. Advise the client to meticulously compare each line item on the medical bill with their insurance explanation of benefits, EOB, and medical records to identify any discrepancies or potential errors before considering payment or dispute. Explanation. This scenario is professionally challenging because understanding medical bills requires a nuanced approach that goes beyond simply identifying charges. Patients often face complex billing statements, insurance jargon, and potential errors, leading to financial distress and mistrust. A financial counselor must navigate these complexities with empathy and accuracy, ensuring the client understands their financial obligations and available recourse. The correct approach represents best professional practice because it prioritizes a thorough, client-centered review of the medical bill. This involves verifying the accuracy of services rendered against the patient's medical records, cross-referencing with insurance explanation of benefits, EOB, and identifying potential billing errors or overcharges. This aligns with the ethical obligation to provide accurate and comprehensive financial guidance, empowering the client to make informed decisions and advocate for themselves. It also implicitly supports the principle of acting in the client's best interest by seeking to minimize unnecessary financial burdens. An incorrect approach that focuses solely on the total amount due without verification fails to uphold professional standards. It risks perpetuating billing errors, leading to the client paying for services not received or being overcharged. This could be considered a failure to exercise due diligence and potentially a breach of fiduciary duty, if such a duty is implied in the counselor-client relationship under relevant U.S. healthcare financial regulations. Another incorrect approach that involves immediately advising the client to dispute every charge without a preliminary review is also professionally unsound. While advocacy is important, an indiscriminate approach can waste the client's time and resources, and may damage their relationship with healthcare providers or insurers. Lacks the strategic, evidence-based approach required for effective financial counseling. This could be seen as unprofessional conduct by not employing a systematic and reasoned problem-solving method. Finally, an approach that dismisses the client's concerns about the bill as simply a matter of insurance coverage without investigating the bill's specifics overlooks potential systemic issues within the billing or insurance process. This demonstrates a lack of thoroughness and could lead to the client missing opportunities to correct errors or negotiate payment terms, thereby failing to provide comprehensive support. This could be interpreted as a failure to adequately assess the client's financial situation and provide appropriate guidance as mandated by professional standards for financial counselors. A professional decision-making process for similar situations should involve 1. Active listening to the client's concerns and gathering all relevant documentation, medical bills, insurance EOBs, medical records. 2. Systematically reviewing the bill for accuracy, comparing services listed with actual care received. 3. Investigating discrepancies between the bill and the EOB. 4. Identifying potential billing errors, coding issues, or duplicate charges. 5. Researching relevant patient rights and consumer protection laws pertaining to medical billing and debt collection in the U.S. 6. Developing a clear, actionable plan for the client, which may include negotiation, dispute resolution, or payment arrangement strategies, always prioritizing the client's financial well-being and understanding. Question 2. The evaluation methodology shows that when advising a client on selecting a healthcare plan that aligns with their financial goals, An AFC should prioritize understanding the financial implications of different healthcare delivery models. Considering a client who is exploring options between a direct primary care model, a traditional fee-for-service model with a PPO, and a managed care model with an HMO, which of the following represents the most appropriate financial counseling approach? Option A. Analyze the potential out-of-pocket expenses, long-term cost projections, and impact on the client's overall budget for each model, while clearly distinguishing financial advice from medical recommendations. Option B. Recommend the direct primary care model as it generally offers more predictable monthly costs, regardless of the client's specific financial situation or other healthcare needs. Option C. Focus solely on the immediate deductibles and co-payments associated with each plan, without considering the broader financial impact or potential for future medical costs. Option D. Advise the client to choose the model that offers the most comprehensive medical coverage, assuming this will always lead to the best financial outcome. The correct answer is A. Analyze the potential out-of-pocket expenses, long-term cost projections, and impact on the client's overall budget for each model, while clearly distinguishing financial advice from medical recommendations. Explanation. Scenario analysis. This scenario presents a professional challenge for an accredited financial counselor, AFC, specializing in healthcare. The challenge lies in advising a client on the financial implications of different healthcare delivery models, without overstepping the scope of financial advice into medical necessity or treatment decisions. The AFC must leverage their understanding of financial planning principles within the context of healthcare economics and regulatory frameworks, ensuring recommendations are financially sound and compliant with relevant U.S. healthcare regulation. Careful judgment is required to distinguish between financial planning advice and medical advice. Correct approach analysis. The correct approach involves analyzing the financial implications of each healthcare delivery model from the client's perspective, considering factors like out-of-pocket costs, insurance coverage, potential for long-term savings, and alignment with the client's overall financial goals. This aligns with the AFC's role to provide objective financial guidance. For example, understanding how a capitated model might affect predictable monthly costs versus a fee-for-service model with variable expenses is crucial. This approach is best professional practice because it directly addresses the client's financial well-being within the healthcare system, adhering to ethical standards of competence and diligence. It also implicitly respects the client's autonomy in making healthcare decisions based on informed financial understanding, without dictating medical choices. This is consistent with the principles of financial counseling, which emphasize client-centered planning. Incorrect approaches analysis. One incorrect approach would be to recommend a specific healthcare delivery model based solely on perceived medical quality or patient satisfaction, without a thorough financial analysis. This fails to uphold the AFC's core competency in financial planning and could lead to significant financial strain for the client if the chosen model is not financially sustainable for them. Ethically, this constitutes practicing outside one's scope of expertise. Another incorrect approach would be to focus exclusively on the immediate out-of-pocket costs of a model without considering its long-term financial impact, such as potential for future medical expenses or the impact on retirement savings. This demonstrates a lack of comprehensive financial planning and could result in suboptimal financial outcomes for the client. It violates the duty to provide advice that considers the client's holistic financial picture. A third incorrect approach would be to provide definitive medical advice or make judgments about the efficacy of treatments within different models. This is a clear violation of professional boundaries and ethical guidelines, as AFCs are not licensed medical professionals. Such actions could lead to adverse health outcomes for the client and expose the AFC to significant legal and professional liability. Professional reasoning. Professionals should employ a decision-making framework that prioritizes client-centered financial planning. This involves 1. Understanding the client's financial situation, goals, and risk tolerance. 2. Thoroughly researching and understanding the financial characteristics of various healthcare delivery models relevant to the client's situation, including their impact on insurance coverage, deductibles, co-pays, and potential out-of-pocket maximums. 3. Clearly explaining these financial implications to the client in an understandable manner, empowering them to make informed decisions. 4. Maintaining strict adherence to professional boundaries, referring clients to appropriate medical professionals for medical advice. 5. Ensuring all advice is compliant with relevant U.S. healthcare and financial regulations. Question 3. The monitoring system demonstrates that a patient is facing significant out-of-pocket expenses for an upcoming elective procedure. The patient expresses concern about the total cost and asks for guidance on how to manage this financial burden. The financial counselor has reviewed the patient's insurance coverage, which has a high deductible and limited coverage for this specific procedure. Which of the following actions best aligns with the role of an accredited financial counselor in this healthcare context? Option A. Advise the patient to seek a second opinion from a different provider who may offer a lower price for the same procedure, suggesting that the current provider's pricing is likely inflated. Option B. Recommend that the patient postpone the procedure indefinitely until their financial situation improves, without exploring any immediate financial mitigation strategies. Option C. Educate the patient on the various payment options available, including installment plans and potential financial assistance programs offered by the healthcare provider, and help them understand the implications of their insurance deductible. Option D. Directly negotiate with the healthcare provider on behalf of the patient to reduce the overall cost of the procedure, leveraging the patient's financial distress. The correct answer is C. Educate the patient on the various payment options available, including installment plans and potential financial assistance programs offered by the healthcare provider, and help them understand the implications of their insurance deductible. Explanation. This scenario is professionally challenging because it requires a financial counselor to navigate the complex interplay between patient financial well-being and the operational realities of healthcare providers, specifically concerning cost structures. The counselor must understand how different cost components influence pricing and patient affordability without overstepping into medical advice or operational management. Careful judgment is required to ensure recommendations are both financially sound for the patient and ethically compliant with healthcare financial counseling standards. The correct approach represents best professional practice because it focuses on empowering the patient with information about their financial obligations and available resources. This aligns with the core principles of financial counseling, which emphasize patient education, informed decision-making, and advocacy within ethical boundaries. Specifically, it adheres to guidelines that require financial counselors to provide clear, unbiased information about costs, payment options, and potential financial assistance programs, thereby promoting transparency and patient autonomy. This approach respects the patient's right to understand their financial landscape and make choices aligned with their personal circumstances, while also acknowledging the provider's need to manage costs. An incorrect approach that focuses solely on negotiating down the provider's listed charges without understanding the underlying cost structures is professionally unacceptable. This could lead to unrealistic expectations for the patient and potentially violate ethical guidelines by misrepresenting the provider's pricing or financial policies. It may also imply an unauthorized role in dictating provider pricing, which is outside the scope of a financial counselor. Another incorrect approach that involves advising the patient to forego necessary medical treatment due to cost concerns without exploring all available financial avenues or alternative care options is ethically problematic. This could be construed as providing medical advice or making decisions that could negatively impact the patient's health, which is beyond the counselor's purview. It fails to uphold the duty of care to explore all reasonable financial solutions before suggesting such drastic measures. A third incorrect approach that involves pressuring the patient to accept a payment plan that is clearly beyond their means, solely to satisfy the provider's immediate billing requirements, is also professionally unacceptable. This violates the principle of acting in the patient's best financial interest and could lead to further financial distress for the patient, potentially damaging their credit and overall financial stability. The professional decision-making process for similar situations should involve a thorough assessment of the patient's financial situation, a clear understanding of the healthcare services and associated costs, and an exploration of all available financial assistance programs, payment options, and insurance benefits. Counselors should prioritize patient education, transparency, and advocacy, ensuring that recommendations are tailored to the patient's individual circumstances and align with ethical and regulatory standards governing healthcare financial counseling. Question 4. Which approach would be most appropriate for an accredited financial counselor? to take when a client with limited understanding of their health insurance plan expresses concern about upcoming medical expenses and seeks guidance on managing these costs. Option A. Focus the discussion solely on comparing the monthly premium costs of various health insurance options, assuming that a lower premium will automatically lead to better cost management for the client's medical expenses. Option B. Advise the client to research and consider switching to a new health insurance plan that appears to have lower monthly premiums, without a thorough analysis of the current plan's coverage or the client's specific healthcare utilization. Option C. Conduct a detailed review of the client's current health insurance policy, explaining key terms such as deductibles, copayments, coinsurance, and out-of-pocket maximums in the context of their anticipated medical needs and financial situation, and then discuss strategies for cost management within that plan. Option D. Provide the client with general information about different types of health insurance plans and common industry terms, without delving into the specifics of their existing policy or their personal financial circumstances. The correct answer is C. Conduct a detailed review of the client's current health insurance policy, explaining key terms such as deductibles, copayments, coinsurance, and out-of-pocket maximums in the context of their anticipated medical needs and financial situation, and then discuss strategies for cost management within that plan. Explanation. This scenario is professionally challenging because a financial counselor must navigate the complexities of health insurance to provide accurate and actionable advice to a client facing significant medical expenses. The client's understanding of their health insurance plan is limited, and they are seeking guidance on how to best utilize their benefits to manage costs. This requires the counselor to not only understand the client's financial situation, but also to interpret and explain intricate insurance policy details, which can vary widely. Careful judgment is required to ensure the advice provided is compliant with relevant regulations and ethical standards, prioritizing the client's well-being and financial security. The correct approach represents best professional practice because it involves a thorough, client-centered review of the existing health insurance plan in conjunction with the client's specific healthcare needs and financial capacity. This aligns with the Accredited Financial Counselor AFC Code of Ethics, which mandates acting in the client's best interest and providing competent advice. Specifically, understanding the nuances of the client's current plan, including deductibles, copayments, coinsurance, out-of-pocket maximums, and network restrictions, is crucial for identifying the most cost-effective strategies. This approach also necessitates educating the client about their options and empowering them to make informed decisions, a core principle of financial counseling. Furthermore, it adheres to the regulatory framework governing financial advice, ensuring that recommendations are grounded in a comprehensive understanding of the client's circumstances and the available insurance provisions. An incorrect approach that focuses solely on comparing premium costs without considering coverage details and out-of-pocket expenses fails to meet the client's fundamental need for understanding how their insurance will actually cover medical services. This is a regulatory and ethical failure because it provides incomplete and potentially misleading information, violating the duty of care and the principle of acting in the client's best interest. Another incorrect approach that involves recommending a new, potentially more expensive plan without a detailed analysis of the client's current plan's adequacy and the client's specific healthcare utilization patterns is also a failure. This could lead to unnecessary financial burden for the client and represents a lack of due diligence, potentially violating regulations that require suitability and appropriateness of recommendations. A third incorrect approach that relies on generic health insurance information without tailoring it to the client's specific policy and circumstances is ethically problematic, as it lacks the personalized attention required for effective financial counseling and may not comply with standards of competence. The professional decision-making process for similar situations should begin with a comprehensive client intake to understand their financial situation, healthcare needs, and current insurance coverage. This should be followed by a detailed review of the client's existing health insurance policy documents, identifying key terms and benefits relevant to their situation. The counselor should then engage in a dialogue with the client to explain these terms in an understandable manner and discuss potential strategies for cost management. Finally, any recommendations should be clearly communicated, justified based on the client's specific circumstances and policy provisions, and documented thoroughly. Question 5. The review process indicates that a client with a chronic condition has a limited understanding of their health insurance policy's cost-sharing mechanisms. The client has provided a general overview of their coverage, but has not presented the actual policy documents. As an accredited financial counselor with a healthcare focus, what is the most appropriate next step to ensure accurate and effective financial guidance? Option A. Advise the client to contact their insurance provider directly for clarification, without reviewing the policy themselves. Option B. Rely on the client's verbal description of their coverage to offer immediate financial planning suggestions. Option C. Provide general advice on managing healthcare expenses for chronic conditions, assuming their policy likely covers most common treatments. Option D. Request and thoroughly review the client's health insurance policy documents to understand the specific details of their coverage for chronic condition management, including deductibles, co-payments, coinsurance, and out-of-pocket maximums. The correct answer is D. Request and thoroughly review the client's health insurance policy documents to understand the specific details of their coverage for chronic condition management, including deductibles, co-payments, coinsurance, and out-of-pocket maximums. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the AFC to navigate the complexities of health insurance coverage for a client with a chronic condition, balancing the client's immediate needs with long-term financial well-being. The client's understanding of their policy is incomplete, necessitating clear and accurate communication from the counselor. Misinterpreting or misrepresenting coverage can lead to significant financial hardship for the client and potential regulatory repercussions for the AFC. Correct approach analysis. The correct approach involves thoroughly reviewing the client's health insurance policy documents, specifically focusing on the details of their coverage for chronic condition management, including deductibles, co-payments, coinsurance, out-of-pocket maximums, and any limitations or exclusions. This aligns with the AFC's ethical duty to provide accurate and comprehensive financial advice based on the client's specific circumstances and the relevant regulatory framework. By understanding the policy's intricacies, the AFC can guide the client in making informed decisions about managing their healthcare costs, which is a core tenet of the accredited financial counselor designation, particularly within the healthcare focus. This approach ensures compliance with regulations that mandate clear disclosure and accurate representation of financial products and services. Incorrect approach is analysis. One incorrect approach would be to rely solely on the client's verbal description of their coverage. This is professionally unacceptable because it bypasses the critical step of verifying information directly from the policy documents. It risks perpetuating misunderstandings and providing advice based on incomplete or inaccurate data, which could violate regulations requiring due diligence and accurate advice. Another incorrect approach would be to provide general advice about managing chronic condition costs without first understanding the specifics of the client's insurance plan. This fails to address the client's unique situation and the specific terms of their coverage, potentially leading to recommendations that are irrelevant or even detrimental. This approach neglects the AFC's responsibility to tailor advice to the individual client's financial landscape, as mandated by professional standards and potentially by consumer protection laws. A third incorrect approach would be to assume that all health insurance policies for chronic conditions offer similar levels of coverage. This is a dangerous generalization that ignores the vast differences in policy structures, benefits, and provider networks. It demonstrates a lack of professional diligence and could result in the client incurring unexpected costs or being denied necessary care, violating ethical obligations and potentially regulatory requirements for accurate product understanding. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough assessment of the client's situation, including their stated needs and existing financial instruments. This is followed by a detailed review of relevant documentation, in this case, the insurance policy. The AFC must then synthesize this information to provide tailored, accurate, and actionable advice, always prioritizing the client's best interests and adhering to all applicable regulations and ethical guidelines. This iterative process of assessment, verification, analysis, and recommendation ensures that advice is grounded in fact and aligned with professional responsibilities. Question 6. The analysis reveals that a healthcare provider client is seeking to understand the implications of individual health insurance policies for their practice, particularly concerning patient access to care and potential revenue streams. The provider is asking for guidance on how different policy structures might affect their ability to serve a diverse patient base and the financial predictability of their practice. Which of the following approaches best aligns with the professional responsibilities and regulatory framework for an accredited financial counselor (AFC) with a healthcare focus? Option A. Advise the client on the tax implications of different individual health insurance subsidies and how to maximize these benefits for their practice's financial planning. Option B. Provide a definitive assessment of which individual health insurance policies are legally compliant for the provider's specific patient demographic, including advice on policy negotiation. Option C. Educate the client on the general types of individual health insurance plans available under the Affordable Care Act, ACA, including key features like deductibles, copayments, coinsurance, and out-of-pocket maximums, and explain the importance of understanding network restrictions and enrollment periods. Option D. Recommend specific insurance carriers and policy plans that the AFC believes would be most beneficial for the healthcare provider's practice, based on the AFC's personal experience. The correct answer is C. Educate the client on the general types of individual health insurance plans available under the Affordable Care Act, ACA, including key features like deductibles, copayments, coinsurance, and out-of-pocket maximums, and explain the importance of understanding network restrictions and enrollment periods. Explanation. This scenario presents a professional challenge because the client, a healthcare provider, is seeking to understand the nuances of individual health insurance policies in the context of their practice. The challenge lies in providing accurate, compliant, and client-centered advice that navigates the complexities of the Affordable Care Act, ACA, and related state regulations without offering specific legal or tax advice, which falls outside the scope of an AFC's practice. The AFC must leverage their understanding of healthcare finance and insurance principles to guide the client toward informed decisions about policy options and their implications for both the provider and their patients. The correct approach represents best professional practice because it focuses on educating the client about the general landscape of individual health insurance, including key provisions of the ACA that impact policy design and availability. This approach aligns with the AFC's role as a financial counselor, empowering the client with knowledge to make informed decisions. It emphasizes understanding policy types, coverage limitations, and enrollment periods, all crucial for a healthcare provider who may be advising patients or considering their own practice's insurance needs. This educational focus respects the boundaries of the AFC's expertise and avoids unauthorized practice of law or insurance brokerage. It also adheres to ethical guidelines that prioritize client education and informed consent. An incorrect approach that involves recommending specific insurance carriers or policy plans would be a regulatory and ethical failure. This constitutes acting as an unlicensed insurance agent or broker, which requires specific licensing and is outside the AFC's scope of practice. Such an action could lead to legal repercussions for the AFC and the client, as well as potential harm to the client if the recommended policies are not suitable. Another incorrect approach, such as providing definitive advice on which policy is best for the client's specific patient population without a thorough understanding of all relevant legal and financial factors, would also be problematic. This oversteps the AFC's role and could lead to misinformed decisions with significant financial and operational consequences for the healthcare practice. Furthermore, failing to disclose the limitations of the AFC's advice and the need for consultation with legal and insurance professionals would be an ethical breach, undermining transparency and client trust. The professional decision-making process for similar situations should involve a clear understanding of the AFC's scope of practice and ethical obligations. Professionals should begin by actively listening to the client's needs and concerns. They should then assess what information can be provided within their expertise, focusing on education and general principles. When the client's needs extend beyond the AFC's scope, such as requiring specific insurance product recommendations or legal interpretation, the professional must clearly communicate these limitations and strongly advise the client to seek guidance from qualified professionals, such as licensed insurance agents, attorneys, or tax advisors. Documentation of these conversations and recommendations is also a critical part of professional practice. Question 7. Quality control measures reveal that a client who is nearing Medicare eligibility and has a chronic but stable health condition is seeking guidance on supplemental insurance options to manage potential out-of-pocket healthcare costs. The accredited financial counselor, AFC, must determine the most appropriate strategy for advising this client. Which of the following approaches best aligns with regulatory requirements and professional ethical standards for providing financial advice in the healthcare context? Option A. Provide the client with a general overview of all available supplemental insurance types without delving into specific plan details or assessing their individual needs, allowing the client to make their own selections. Option B. Advise the client to enroll in the most comprehensive Medicare Advantage plan available, assuming it will cover all potential healthcare needs and reduce out-of-pocket expenses without requiring further investigation into other supplemental options. Option C. Recommend a specific Medicare supplement insurance, Medigap plan that offers the lowest monthly premium, as minimizing immediate costs is generally the primary concern for individuals approaching Medicare. Option D. Conduct a detailed assessment of the client's current health insurance, anticipated medical expenses, and overall financial goals to identify specific coverage gaps. Then research and present a comparative analysis of suitable supplemental insurance options, explaining the benefits, limitations, and costs of each in the context of U.S. healthcare regulations and the client's unique situation. The correct answer is D. Conduct a detailed assessment of the client's current health insurance, anticipated medical expenses, and overall financial goals to identify specific coverage gaps. Then research and present a comparative analysis of suitable supplemental insurance options, explaining the benefits, limitations, and costs of each in the context of U.S. healthcare regulations and the client's unique situation. Explanation. This scenario is professionally challenging because it requires the accredited financial counselor AFC to navigate the complexities of supplemental insurance options within the specific regulatory landscape of the United States, particularly as it pertains to healthcare. The AFC must ensure that any recommendations are not only financially sound for the client, but also compliant with federal and state insurance laws, as well as ethical guidelines for financial advice. The client's specific healthcare needs and financial situation, combined with the nuances of various supplemental insurance products, demand a thorough and personalized approach. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the client's unique circumstances and the available supplemental insurance options. This involves a detailed assessment of their current health insurance coverage, anticipated out-of-pocket medical expenses, and overall financial goals. By thoroughly researching and comparing different types of supplemental insurance, such as Medicare supplement insurance, Medigap, Medicare Advantage plans, and critical illness policies, the AFC can provide informed recommendations. This aligns with the fiduciary duty often expected of financial professionals, ensuring that advice is given in the client's best interest. Furthermore, adherence to regulations like the Health Insurance Portability and Accountability Act, HIPAA, for patient privacy and state-specific insurance sales regulations is paramount. An incorrect approach that involves recommending a specific supplemental insurance product without a thorough needs assessment fails to uphold the client's best interests and may violate ethical standards. This could lead to the client purchasing coverage that is either inadequate for their needs or unnecessarily expensive, potentially causing financial harm. Such an approach could also be seen as a conflict of interest if the AFC receives undisclosed compensation for recommending a particular product. Another incorrect approach, which is to solely focus on the lowest premium without considering the benefits and coverage limitations, is also professionally unacceptable. This overlooks the primary purpose of supplemental insurance, which is to mitigate significant financial risk associated with healthcare costs. Failing to explain the trade-offs between premiums and coverage can lead to client dissatisfaction and financial distress when claims are denied or insufficient. This demonstrates a lack of due diligence and a failure to provide comprehensive financial guidance. A third incorrect approach, which is to provide generic information about supplemental insurance without tailoring it to the client's specific situation, is insufficient. While providing general education is part of the process, it does not fulfill the AFC's responsibility to offer personalized advice. This can leave the client confused and unable to make an informed decision, potentially leading to suboptimal financial outcomes. The professional decision-making process for similar situations should involve a structured approach. 1. Client discovery. Conduct a thorough interview to understand the client's current health status, existing insurance, anticipated healthcare needs, risk tolerance, and financial capacity. 2. Needs analysis. Quantify potential out-of-pocket expenses and identify gaps in current coverage that supplemental insurance could address. 3. Product research. Investigate various supplemental insurance options available in the U.S. market, focusing on their benefits, limitations, costs, and regulatory compliance. 4. Comparative analysis. Present a clear comparison of suitable options, highlighting the pros and cons of each in relation to the client's specific needs and financial situation. 5. Informed recommendation. Provide a well-reasoned recommendation, explaining the rationale behind it and ensuring the client fully understands the implications of their choice. 6. Documentation. Maintain detailed records of the client's situation, the options discussed, and the final decision, along with the reasoning. Question 8. Quality control measures reveal that a financial counselor advising a client on a significant healthcare investment has primarily utilized a single economic evaluation method, without fully exploring alternative methodologies or disclosing potential personal incentives related to the investment's financial performance. Which approach best aligns with professional best practices and regulatory expectations for accredited financial counselors in the healthcare sector? Option A. Employing a diverse range of economic evaluation methods, transparently discussing their respective strengths, weaknesses, and assumptions with the client, and fully disclosing any potential conflicts of interest that could influence the recommendation. Option B. Prioritizing the economic evaluation method that is most familiar to the counselor, regardless of its suitability for the specific healthcare investment. Option C. Relying on the economic evaluation method that yields the most favorable financial outcome for the client, assuming this inherently serves their best interests. Option D. Focusing exclusively on the economic evaluation method that is mandated by the healthcare provider, without independent verification or client consultation. The correct answer is A. Employing a diverse range of economic evaluation methods, transparently discussing their respective strengths, weaknesses, and assumptions with the client, and fully disclosing any potential conflicts of interest that could influence the recommendation. Explanation. This scenario presents a professional challenge because financial counselors advising healthcare clients must navigate complex economic evaluations while adhering to strict ethical and regulatory standards, particularly concerning the disclosure of potential conflicts of interest and the suitability of recommendations. The core of the challenge lies in ensuring that the chosen economic evaluation method is not only technically sound, but also transparent and aligned with the client's best interests, especially when the counselor may have a vested interest in a particular outcome. The correct approach represents best professional practice because it prioritizes a comprehensive and unbiased assessment of all relevant economic evaluation methods. This involves a thorough understanding of the strengths and limitations of each method, e.g., cost-benefit analysis, cost-effectiveness analysis, cost-utility analysis, in the context of the specific healthcare decision being evaluated. Best practice dictates selecting the method that most accurately reflects the client's goals and the nature of the healthcare intervention, while also ensuring that any potential conflicts of interest are fully disclosed and managed according to the Accredited Financial Counselor AFC Code of Ethics and relevant U.S. healthcare financial regulations. Transparency in methodology and potential biases is paramount to maintaining client trust and fulfilling fiduciary duties. An incorrect approach that relies solely on a single, potentially biased economic evaluation method, without considering alternatives or disclosing conflicts, fails to meet professional standards. This could lead to recommendations that are not truly in the client's best interest, potentially violating regulations that require suitability and disclosure. For instance, using a cost-benefit analysis that overemphasizes financial returns while downplaying quality-of-life improvements, especially if the counselor has a financial incentive tied to the financial returns, would be ethically problematic. Another failure would be to omit a discussion of the assumptions and limitations inherent in the chosen method, leaving the client with an incomplete understanding of the economic implications. Such omissions can be construed as a breach of the duty of care and a violation of regulations requiring clear and accurate client communication. Professionals should employ a decision-making framework that begins with a clear understanding of the client's objectives and risk tolerance. This is followed by an objective assessment of available economic evaluation methods, considering their applicability to the specific healthcare scenario. Crucially, any potential conflicts of interest must be identified and disclosed upfront. The chosen method should then be applied transparently, with all assumptions and limitations clearly communicated to the client. Regular review and reevaluation of the chosen method and its outcomes are also essential to ensure ongoing suitability and adherence to ethical and regulatory requirements. Question 9. During the evaluation of a client's financial plan, they express a strong preference for a specific cutting-edge medical treatment that is currently only available through private healthcare providers. The client has a moderate income and limited savings. As an accredited financial counselor (AFC) operating under U.S. regulations, what is the most appropriate course of action to guide this client? Option A. Conduct a thorough analysis of the client's current and projected financial situation, exploring the full cost implications of the preferred private treatment versus alternative treatments available through public healthcare options or less expensive private plans, and present a clear comparison of financial impacts and risks. Option B. Recommend that the client explore all publicly funded healthcare programs first, regardless of their stated preference for private care, to ensure the absolute lowest cost, even if it means delaying or foregoing the preferred treatment. Option C. Immediately advise the client to pursue the preferred private treatment, assuming their desire indicates it is the best and only viable option, and help them explore personal loan options to cover the costs. Option D. Focus solely on the medical necessity and perceived benefits of the preferred treatment, downplaying the financial considerations to avoid discouraging the client from seeking potentially life-saving care. The correct answer is A. Conduct a thorough analysis of the client's current and projected financial situation, exploring the full cost implications of the preferred private treatment versus alternative treatments available through public healthcare options or less expensive private plans, and present a clear comparison of financial impacts and risks. Explanation. This scenario presents a professional challenge because a financial counselor must navigate a client's complex healthcare needs and financial situation, which are deeply intertwined with the nuances of public versus private healthcare systems. The client's desire for a specific treatment, coupled with their limited understanding of how different healthcare funding models impact accessibility and cost, requires a counselor to provide clear, unbiased, and actionable guidance. The challenge lies in translating intricate healthcare policy and financial implications into understandable terms, ensuring the client can make an informed decision aligned with their financial capacity and healthcare goals. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the client's current financial standing, future financial projections, and their specific healthcare needs and preferences. It involves a thorough analysis of how both public and private healthcare options, within the specified U.S. regulatory framework, would impact their financial well-being. This includes evaluating out-of-pocket expenses, insurance coverage under different scenarios, e.g., employer-sponsored, marketplace, Medicare, Medicaid, and the long-term financial sustainability of chosen healthcare pathways. Adherence to the AFC Code of Ethics, which mandates acting in the client's best interest and providing objective advice, is paramount. This approach ensures that the client's decision is grounded in a realistic assessment of financial implications, avoiding potential future financial distress. An incorrect approach that focuses solely on the client's immediate desire for a specific treatment without a thorough financial assessment would be professionally unacceptable. This failure stems from a lack of due diligence and a potential violation of the duty to provide comprehensive financial advice. It neglects the core responsibility of an AFC to consider the long-term financial health of the client. Another incorrect approach that prioritizes only the most expensive private healthcare option without exploring cost-effective public alternatives or understanding the client's financial limitations would also be a failure. This demonstrates a lack of fiduciary responsibility and could lead to the client incurring unsustainable debt. Furthermore, an approach that relies on incomplete or inaccurate information about the coverage provided by different healthcare plans, whether public or private, constitutes a significant ethical and regulatory failure, potentially misrepresenting the financial realities to the client. The professional decision-making process for similar situations should involve a structured approach. 1. Client discovery. Conduct a deep dive into the client's financial situation, healthcare needs, preferences, and risk tolerance. 2. Information gathering. Collect detailed information on available public and private healthcare options relevant to the client's circumstances, including coverage details, costs, and eligibility criteria. 3. Analysis. Systematically analyze the financial implications of each viable healthcare option, considering short-term and long-term costs, potential out-of-pocket expenses, and the impact on the client's overall financial plan. 4. Education and recommendation. Clearly explain the findings to the client in an understandable manner, outlining the pros and cons of each option from a financial perspective. Provide objective recommendations based on the analysis and the client's stated goals, empowering them to make an informed decision. 5. Documentation. Maintain thorough records of the client's situation, the information provided, the analysis performed, and the client's final decision. Question 10. Market research demonstrates that many individuals struggle to align their financial planning with the complexities of the U.S. healthcare system. A client, recently diagnosed with a chronic condition, approaches you for financial guidance. They express confusion about how their new diagnosis will impact their current health insurance coverage and future medical expenses, and they are unsure how to best manage these costs financially. Which of the following approaches would best serve this client's needs while adhering to professional and regulatory standards? Option A. Explain the general principles of health insurance deductibles, co-pays, and co-insurance, and then recommend that the client focus on minimizing their current healthcare utilization to reduce immediate expenses. Option B. Assume the client has a good understanding of healthcare terminology and immediately present a list of high-deductible health plans as a cost-saving measure for their chronic condition. Option C. Provide a comprehensive overview of the U.S. healthcare system, detailing the differences between Medicare, Medicaid, and private insurance, and then advise the client to research the most affordable health insurance options available in their state. Option D. Begin by thoroughly assessing the client's current health insurance plan, understanding the specifics of their chronic condition and its treatment, and then developing a personalized financial strategy that addresses potential out-of-pocket costs, explores available financial assistance programs, and considers long-term financial implications. The correct answer is D. Begin by thoroughly assessing the client's current health insurance plan, understanding the specifics of their chronic condition and its treatment, and then developing a personalized financial strategy that addresses potential out-of-pocket costs, explores available financial assistance programs, and considers long-term financial implications. Explanation. This scenario is professionally challenging because financial counselors advising healthcare clients must navigate a complex interplay of healthcare delivery models, insurance regulations, and individual financial needs. The core difficulty lies in translating broad healthcare system knowledge into actionable, personalized financial advice that respects patient autonomy and adheres to regulatory mandates. Careful judgment is required to avoid making assumptions about a client's understanding or financial capacity, and to ensure advice is both compliant and effective. The correct approach represents best professional practice because it prioritizes a client-centered methodology grounded in understanding the client's specific circumstances and preferences within the existing healthcare landscape. This aligns with the ethical obligation to act in the client's best interest and the regulatory requirement to provide suitable advice. By first assessing the client's current healthcare utilization and financial goals, the counselor can then tailor recommendations regarding insurance options, cost-saving strategies, and long-term financial planning that are relevant and achievable for that individual. This approach respects the client's agency and ensures that financial advice is directly linked to their healthcare journey. An incorrect approach that focuses solely on explaining the intricacies of different healthcare systems without assessing the client's personal situation fails to provide relevant financial guidance. This is a regulatory and ethical failure because it neglects the fundamental duty to provide advice tailored to the client's needs. It can lead to confusion and inaction, as the client may not understand how the system information applies to them. Another incorrect approach that emphasizes only the most cost-effective insurance plans without considering the client's specific healthcare needs or risk tolerance is also professionally unacceptable. This violates the principle of suitability and can result in inadequate coverage, leading to significant out-of-pocket expenses and financial distress. Ethically, it prioritizes cost over comprehensive care, and regulatorily, it may breach guidelines requiring advice to be appropriate for the client's circumstances. A third incorrect approach that assumes all clients have a similar understanding of healthcare terminology and processes is problematic. This can lead to miscommunication and a failure to address the client's actual concerns. It is an ethical lapse as it does not ensure clear communication and understanding, and it can be a regulatory issue if it results in advice that is not fully comprehended or acted upon appropriately due to a lack of clarity. The professional decision-making process for similar situations should involve a structured approach. 1. Active listening and information gathering. Understand the client's current healthcare situation, past experiences, financial status, and future goals. 2. Needs assessment. Identify the client's specific healthcare needs, potential risks, and financial capacity. 3. System education tailored. Explain relevant aspects of the healthcare system as they pertain to the client's situation, avoiding jargon and focusing on practical implications. 4. Solution development. Propose financial strategies and healthcare-related options that align with the client's needs, goals, and regulatory requirements. 5. Client empowerment. Ensure the client understands the advice and has the information to make informed decisions. Question 11. Cost-benefit analysis shows that an individual aged 67 with limited income and significant ongoing medical expenses is seeking guidance on managing their healthcare costs. They are eligible for Medicare Part A and Part B. Which of the following approaches best ensures they are accessing the most financially advantageous coverage available through federal programs? Option A. Advise the client to enroll in Medicare Parts A and B and explore Medicare Savings Programs, MSP, by verifying their income and asset levels against state-specific eligibility requirements for programs like Qualified Medicare Beneficiary, QMB, Specified Low-Income Medicare Beneficiary, SLMB, or Qualified Individual CHI. Option B. Inform the client that since they are over 65 and eligible for Medicare, they automatically qualify for all available Medicare savings programs and should expect their out-of-pocket costs to be fully covered. Option C. Advise the client to disenroll from Medicare and focus exclusively on obtaining comprehensive private health insurance, as this will provide superior coverage and potentially lower long-term costs. Option D. Recommend that the client solely rely on their Medicare Parts A and B coverage, as this is the primary federal health insurance for individuals over 65, and suggest they seek additional coverage through private supplemental insurance if needed. The correct answer is A. Advise the client to enroll in Medicare Parts A and B and explore Medicare Savings Programs, MSP, by verifying their income and asset levels against state-specific eligibility requirements for programs like Qualified Medicare Beneficiary, QMB, Specified Low-Income Medicare Beneficiary, SLMB, or Qualified Individual CHI. Explanation. This scenario is professionally challenging because it requires a financial counselor to navigate the complex and often overlapping eligibility requirements and benefit structures of both Medicare and Medicaid, specifically in the context of healthcare services. The counselor must understand how these programs interact and how an individual's financial situation and healthcare needs can impact their eligibility for one or both programs. Careful judgment is required to ensure the client receives accurate information and is guided towards the most beneficial and appropriate coverage without misrepresenting program rules or creating false expectations. The correct approach represents best professional practice because it prioritizes a thorough, individualized assessment of the client's situation. By understanding the client's specific income, assets, and healthcare needs, the counselor can accurately determine eligibility for Medicare Savings Programs, MSP, and Medicaid. This allows for the identification of the most cost-effective way to cover healthcare expenses, potentially reducing out-of-pocket costs and ensuring access to necessary services. This aligns with the ethical obligation to provide competent and client-centered advice, adhering strictly to the regulations governing Medicare and Medicaid in the United States. An incorrect approach that focuses solely on Medicare enrollment without considering Medicaid eligibility fails to acknowledge the potential for dual eligibility and the significant cost savings Medicaid can offer for low-income individuals, particularly those with high medical expenses. This oversight can lead to the client paying more for health care than necessary, violating the principle of acting in the client's best financial interest. Another incorrect approach that assumes all individuals over 65 are automatically eligible for all Medicare savings programs without verifying income and asset levels is a direct violation of program regulations. This can lead to incorrect advice and potentially disqualify individuals who might otherwise be eligible. It also fails to recognize that MSPs have specific income and asset limits that must be met. An incorrect approach that advises the client to solely rely on private insurance without exploring Medicare and Medicaid options ignores the primary purpose of these government programs, which are designed to provide affordable healthcare coverage to specific populations. This would be a failure to adequately inform the client of all available resources and could result in them incurring significantly higher healthcare costs. The professional decision-making process for similar situations should involve a systematic approach. 1. Client assessment. Gather comprehensive information about the client's age, income, assets, household size, and specific healthcare needs. 2. Program identification. Identify all relevant federal and state programs for which the client might be eligible, including Medicare, Medicaid, and specific Medicare savings programs. 3. Eligibility verification. Thoroughly research and apply the eligibility criteria for each identified program using official government resources. 4. Benefit comparison. Analyze the benefits and cost-sharing structures of each program to determine the most advantageous option for the client's specific circumstances. 5. Informed recommendation. Provide clear, accurate, and unbiased advice to the client, explaining the implications of each option and empowering them to make an informed decision. 6. Regulatory adherence. Ensure all advice and guidance strictly comply with the regulations of the relevant programs, e.g., Social Security Act for Medicare and Medicaid. Question 12. Regulatory review indicates that a client is seeking immediate health insurance coverage due to a gap in their current plan and is primarily focused on minimizing monthly premiums. They have expressed interest in short-term health insurance options. Which approach best aligns with the AFC's professional responsibilities and regulatory obligations in this scenario? Option A. Advise the client that short-term health insurance is a suitable long-term solution for managing healthcare costs and recommend a plan that offers basic coverage for a defined period. Option B. Thoroughly explain the limitations of short-term health insurance, including its ineligibility for essential health benefits, potential for coverage gaps, and lack of protection for pre-existing conditions, while also exploring alternative ACA-compliant coverage options that may offer more comprehensive protection, even if at a higher premium. Option C. Recommend the short-term health insurance plan with the lowest monthly premium, emphasizing its immediate availability and cost savings as the primary benefit for the client. Option D. Focus on the coverage details of the short-term plan, highlighting its benefits without discussing potential exclusions, limitations, or the implications of pre-existing conditions to avoid overwhelming the client with complex information. Correct answer is B. Thoroughly explain the limitations of short-term health insurance, including its ineligibility for essential health benefits, potential for coverage gaps, and lack of protection for pre-existing conditions, while also exploring alternative ACA-compliant coverage options that may offer more comprehensive protection, even if at a higher premium. Explanation. This scenario presents a professional challenge because short-term health insurance, while offering a temporary solution, carries significant limitations that can impact a client's long-term financial well-being and access to necessary health care. The accredited financial counselor, AFC, must navigate the client's immediate need for coverage against the potential for inadequate protection and unexpected costs, all within the bounds of U.S. federal and state insurance regulations. The correct approach represents best professional practice because it prioritizes a comprehensive risk assessment that aligns with the AFC's fiduciary duty to act in the client's best interest. This involves thoroughly explaining the nature of short-term plans, including their limitations regarding pre-existing conditions, essential health benefits, and annual/lifetime maximums, as well as the potential for coverage gaps. By empowering the client with this knowledge, the AFC enables informed decision-making, ensuring the client understands the trade-offs and potential financial exposure. This aligns with the principles of client education and transparency mandated by ethical codes and consumer protection laws, such as those enforced by the Centers for Medicare and Medicaid Services, CMS, and state insurance departments. An incorrect approach that focuses solely on the immediate cost savings of short-term insurance fails to adequately address the client's underlying need for comprehensive health coverage and the potential for significant out-of-pocket expenses if a serious health event occurs. This oversight can lead to financial distress for the client and may violate regulations that require financial professionals to recommend suitable products based on a client's circumstances, not just their immediate affordability. Another incorrect approach that suggests short-term insurance is a suitable long-term solution ignores the inherent limitations of these plans and the regulatory framework that designates them as temporary. Recommending such a plan as a permanent fixture would be a misrepresentation of its purpose and could expose the client to substantial financial risk and lack of essential care, potentially violating state insurance laws and ethical standards. A third incorrect approach that fails to discuss the potential for coverage denials or limitations based on pre-existing conditions overlooks critical consumer protections and disclosure requirements. Short-term plans are generally not subject to the same rules as ACA-compliant plans regarding pre-existing conditions, and failing to inform the client of this can lead to unexpected and costly surprises, violating principles of transparency and fair dealing. The professional decision-making process for similar situations should involve a structured approach. 1. Understand the client's immediate need and underlying financial goals. 2. Educate the client thoroughly on the characteristics, benefits, and significant limitations of any proposed product, especially those with temporary or limited coverage. 3. Assess the client's risk tolerance and financial capacity to absorb potential out-of-pocket costs. 4. Explore all available coverage options, including ACA-compliant plans, Medicaid, and employer-sponsored insurance, before considering short-term options. 5. Document all discussions, recommendations, and client decisions meticulously. 6. Ensure all recommendations comply with federal and state insurance regulations, including those pertaining to short-term, limited-duration insurance. Question 13. The evaluation methodology shows that a patient's pre-authorization for a medically necessary procedure has been denied by their managed care organization, MCO. The patient is concerned about the financial implications and the delay in receiving care. Which of the following actions best aligns with the accredited financial counselor's role in this situation, adhering strictly to U.S. healthcare and insurance regulatory frameworks? Option A. Guide the patient through understanding the MCO's internal appeals process, including their rights to external review and providing resources for assistance. Option B. Contact the MCO directly to negotiate a reduced rate for the procedure, bypassing the pre-authorization denial. Option C. Advise the patient to immediately seek out-of-network care and explore personal loan options to cover the costs. Option D. Focus on explaining the patient's out-of-pocket maximum and deductible, suggesting they prepare for full payment if the denial is upheld. Correct answer is C. Advise the patient to immediately seek out-of-network care and explore personal loan options to cover the costs. Explanation. This scenario is professionally challenging because it requires a financial counselor to navigate the complexities of managed care contracts and their impact on patient access to care, while adhering to specific regulatory frameworks governing healthcare finance and patient advocacy. The counselor must balance the financial interests of the patient with the contractual obligations and operational realities of managed care organizations. MCO. The correct approach represents best professional practice because it prioritizes patient advocacy within the established regulatory framework. By focusing on understanding the specific MCO's utilization review process and appeal rights, the counselor is empowering the patient with knowledge and actionable steps. This aligns with the ethical obligation to act in the patient's best interest and to ensure they receive the care they are entitled to under their plan. Adherence to regulations like the Affordable Care Act, ACA, and state-specific insurance laws, which often mandate clear appeal processes and patient rights, is paramount. An incorrect approach that focuses solely on the patient's financial responsibility without exploring MCO recourse fails to uphold the counselor's duty of care and may violate regulations requiring assistance with navigating insurance benefits. Another incorrect approach that involves directly negotiating with the MCO on behalf of the patient without proper authorization or understanding of the MCO's internal processes could lead to misrepresentation or procedural errors, potentially violating patient privacy laws, like HIPAA and insurance regulations. A third incorrect approach that suggests abandoning the MCO and seeking alternative, potentially out-of-network care, without exhausting all in-network options and appeal processes is premature and may not be in the patient's best financial or clinical interest, potentially violating best practice guidelines for financial counseling in healthcare. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's specific insurance plan and the MCO's contract terms. This involves identifying the patient's rights and the available recourse mechanisms within the MCO's framework. The next step is to educate the patient about these options and collaboratively develop a strategy. This strategy should prioritize exhausting all in-network appeals and grievance procedures before considering out-of-network alternatives or other financial solutions. Throughout this process, maintaining clear, documented communication with the patient and adhering to all relevant federal and state healthcare and insurance regulations is essential. Question 14. The assessment process reveals that a patient, Mr. Harrison, is experiencing significant anxiety regarding the cost of an upcoming medical procedure. He expresses reluctance to discuss his financial situation in detail, fearing that his inability to afford the full cost might negatively impact the quality of his care or lead to judgment from the healthcare team. As an accredited financial counselor specializing in healthcare, how should you proceed to best support Mr. Harrison? Option A. Advise Mr. Harrison that financial matters are separate from medical care and that he should focus solely on his treatment plan, assuring him that the healthcare providers will handle any financial discussions. Option B. Gently suggest that if he cannot afford the recommended procedure, he may need to reconsider its necessity or explore options outside of the current healthcare system to manage his costs. Option C. Explain the importance of understanding his financial picture to identify potential financial assistance programs and payment options, assuring him that all information shared will be kept confidential within the scope of your professional role and relevant regulations, and then ask for his permission to discuss specific financial details relevant to exploring these resources. Option D. Immediately contact Mr. Harrison's physician to inform them of his financial concerns, suggesting they explore less expensive treatment alternatives that might be more manageable for his budget. The correct answer is C. Explain the importance of understanding his financial picture to identify potential financial assistance programs and payment options, assuring him that all information shared will be kept confidential within the scope of your professional role and relevant regulations, and then ask for his permission to discuss specific financial details relevant to exploring these resources. Explanation. This scenario presents a professional challenge because the financial counselor must navigate the complex interplay between a patient's immediate financial distress, their healthcare needs, and the ethical obligations of confidentiality and professional scope of practice. The patient's reluctance to share information due to fear of judgment or impact on their care creates a delicate situation requiring trust building and clear communication. The financial counselor's role is to empower the patient with information and resources, not to make decisions for them or to overstep professional boundaries. The correct approach represents best professional practice because it prioritizes patient autonomy and informed consent. By explaining the purpose of information gathering, assuring confidentiality within legal and ethical limits, and focusing on the financial implications of treatment options, the financial counselor respects the patient's dignity and right to self-determination. This aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and justice, fair distribution of resources and care, as well as regulatory frameworks that emphasize patient privacy and informed decision-making in healthcare financial matters. The counselor is acting within their scope by providing financial education and resource navigation, not medical advice or direct patient care. An incorrect approach that involves immediately disclosing the patient's financial situation to the healthcare provider without explicit consent would violate patient confidentiality laws, such as HIPAA in the U.S., and ethical codes of conduct. This action breaches trust and could lead to discrimination or a reluctance by the patient to seek future care. Another incorrect approach, such as pressuring the patient to accept a specific treatment plan based solely on perceived financial feasibility, oversteps the counselor's role and infringes upon the patient's right to make healthcare decisions in consultation with their medical team. This could also be seen as a form of coercion. Finally, an approach that dismisses the patient's financial concerns as irrelevant to their medical treatment fails to acknowledge the significant impact financial stability has on health outcomes and adherence to care plans, thereby not acting in the patient's holistic best interest. The professional decision-making process for similar situations should involve a structured approach. First, actively listen to and acknowledge the patient's concerns and fears. Second, clearly articulate the financial counselor's role, scope of practice, and commitment to confidentiality. Third, explain the benefits of sharing relevant financial information for the purpose of identifying appropriate resources and solutions. Fourth, obtain informed consent for any information sharing. Fifth, focus on providing education, exploring options, and connecting the patient with available resources, always respecting their autonomy in decision-making. Question 15. Implementation of a new treatment plan for a patient with a chronic condition has been discussed. The patient has been provided with a detailed breakdown of estimated costs, including co-pays, deductibles, and potential out-of-network charges. The patient has verbally acknowledged receipt of the information and stated they understand. As an accredited financial counselor, AFC focused on healthcare, what is the most effective method to ensure the patient truly comprehends the financial implications of this treatment plan? Option A. Provide the patient with a comprehensive written document and confirm they have read it. Option B. Focus solely on the immediate out-of-pocket expenses for the next billing cycle. Option C. Ask the patient to explain in their own words what they understand about the costs, their payment responsibilities, and any available financial assistance programs. Option D. Rely on the patient's verbal confirmation of understanding, assuming they will ask questions if they have any. The correct answer is C. Ask the patient to explain in their own words what they understand about the costs, their payment responsibilities, and any available financial assistance programs. Explanation. Scenario analysis. This scenario is professionally challenging because assessing a patient's understanding of complex healthcare costs, especially in the context of a chronic condition requiring ongoing treatment, demands more than a simple verbal confirmation. Patients may agree to a plan or express understanding due to politeness, fear, or a genuine lack of comprehension of the financial implications. The AFC must navigate potential communication barriers, varying levels of health literacy, and the emotional stress associated with a diagnosis to ensure true comprehension, which is critical for informed decision-making and adherence to treatment plans. Correct approach analysis. The correct approach involves utilizing a teach-back method. This technique requires the patient to explain in their own words what they understand about their treatment costs, potential out-of-pocket expenses, and available financial assistance options. This method directly assesses comprehension by shifting the burden of explanation to the patient, revealing any gaps in understanding. This aligns with ethical principles of patient autonomy and informed consent, as mandated by healthcare regulations that emphasize clear communication and patient comprehension to ensure they can make informed choices about their care and associated financial responsibilities. Incorrect approaches analysis. One incorrect approach involves relying solely on the patient's verbal affirmation of understanding. This fails to account for potential misunderstandings or the patient's reluctance to admit confusion, leading to a false sense of comprehension. This can violate regulatory requirements for clear and understandable communication, potentially leading to financial distress for the patient and non-adherence to treatment. Another incorrect approach is to provide a lengthy, jargon-filled document detailing all costs without actively checking for comprehension. This approach assumes the patient can independently decipher complex financial information, which is often not the case, especially for individuals with lower health literacy. This neglects the professional obligation to ensure information is accessible and understood, potentially leading to a breach of fiduciary duty and regulatory noncompliance regarding patient education. A third incorrect approach is to focus only on the immediate out-of-pocket costs without discussing long-term financial implications or available support programs. This provides an incomplete financial picture and fails to equip the patient with the knowledge needed for sustainable financial management of their healthcare. This can be seen as a failure to provide comprehensive financial counseling, a core competency for an AFC, and may contravene guidelines that promote holistic financial well-being. Professional reasoning. Professionals should adopt a patient-centered communication strategy. This involves active listening, using plain language, and employing methods like teach-back to confirm understanding. When assessing comprehension of healthcare costs, the AFC should break down information into manageable parts, address potential financial barriers proactively, and offer resources for further assistance. The decision-making process should prioritize ensuring the patient can articulate their understanding of the financial commitments and available options, thereby empowering them to make informed decisions aligned with their financial capacity and treatment needs. Question 16. The audit findings indicate a need to refine the process for developing financial plans for patients undergoing significant medical treatment. Which of the following approaches best aligns with regulatory requirements and ethical best practices for an accredited financial counselor (AFC) in the U.S. healthcare sector? Option A. Recommend specific investment products or insurance policies that may offer tax advantages for healthcare expenses, without a thorough understanding of the patient's overall financial picture or their specific healthcare needs and prognosis. Option B. Provide general financial guidance on managing debt and budgeting, assuming the patient will independently navigate the complexities of their healthcare financing and insurance coverage. Option C. Prioritize immediate cost-saving measures for the patient's healthcare expenses, focusing on the lowest-cost treatment options available, without extensive consideration of long-term health outcomes or the patient's broader financial stability. Option D. Conduct a comprehensive assessment of the patient's current financial situation, risk tolerance, and future financial goals, and then develop a financial plan that integrates these with the projected costs and financial implications of their healthcare treatment options, ensuring full disclosure and compliance with all relevant U.S. regulations. The correct answer is D. Conduct a comprehensive assessment of the patient's current financial situation, risk tolerance, and future financial goals, and then develop a financial plan that integrates these with the projected costs and financial implications of their healthcare treatment options, ensuring full disclosure and compliance with all relevant U.S. regulations. Explanation: this scenario is professionally challenging because it requires balancing the patient's immediate financial anxieties with the long-term implications of their healthcare decisions, all within the strict confines of U.S. federal and state healthcare and financial regulations. The accredited financial counselor, AFC, must act as a fiduciary, prioritizing the patient's best interests while ensuring compliance with laws such as HIPAA, ERISA if applicable to employer-sponsored plans, and state-specific consumer protection laws related to financial advice. The audit findings highlight a potential gap in the counselor's process for integrating financial planning with healthcare needs, suggesting a need for a more holistic and compliant approach. The correct approach represents best professional practice because it directly addresses the patient's stated financial concerns while proactively incorporating the complexities of their healthcare situation and the relevant regulatory landscape. This involves a thorough assessment of the patient's current financial status, risk tolerance, and future financial goals, and then aligning these with the projected costs and financial implications of their healthcare treatment options. This approach ensures that the financial plan is not only realistic, but also compliant with all applicable regulations, such as those governing disclosure of fees, conflicts of interest, and the suitability of recommendations. It emphasizes clear communication and documentation, which are critical for demonstrating adherence to professional standards and regulatory requirements. An incorrect approach that focuses solely on immediate cost reduction without considering the long-term health outcomes or the patient's overall financial well-being would be professionally unacceptable. This could lead to recommendations that compromise necessary medical care, creating a fiduciary breach and potential liability. Another incorrect approach that involves providing financial advice without fully understanding the patient's healthcare context or without disclosing potential conflicts of interest would violate ethical guidelines and potentially regulatory requirements related to financial advisory services. Failing to consider the patient's risk tolerance when recommending financial products or strategies related to healthcare expenses would also be a significant ethical and regulatory failure, as it would not be in the patient's best interest. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the client's situation, encompassing both their financial and healthcare needs. This involves active listening, thorough data gathering, and a deep understanding of the regulatory environment. Recommendations should be tailored, transparent, and documented, with a clear explanation of how they align with the client's goals and risk profile. Regular review and adjustment of the plan are also essential, especially given the dynamic nature of healthcare costs and personal financial circumstances. Question 17. Quality control measures reveal that a client, facing an upcoming elective medical procedure, expresses significant anxiety and confusion regarding their health insurance's cost-sharing responsibilities. They state, "I thought my insurance would just pay for everything after my premium, but now I'm hearing about deductibles and copays, and I don't understand how much I'll actually have to pay out of pocket. It feels like a trap." As an accredited financial counselor specializing in healthcare, what is the most appropriate course of action? Option A. Advise the client to contact their insurance provider directly for all cost-related inquiries, stating that as a financial counselor, your role is limited to general budgeting advice and not specific insurance plan interpretation. Option B. Reassure the client that their insurance plan is designed to cover most costs and advise them to focus on the medical necessity of the procedure, suggesting they will figure out the exact payment details once the bills start arriving. Option C. Schedule a dedicated session to thoroughly explain the definitions and practical implications of copayments, deductibles, and coinsurance, using the client's specific insurance plan details to illustrate how these components will affect their out-of-pocket expenses for the upcoming procedure and ongoing care. Option D. Suggest the client explore alternative, lower-cost healthcare providers or facilities that might have simpler payment structures, without fully investigating the implications of their current insurance plan's cost-sharing for the procedure. The correct answer is C. Schedule a dedicated session to thoroughly explain the definitions and practical implications of copayments, deductibles, and coinsurance, using the client's specific insurance plan details to illustrate how these components will affect their out-of-pocket expenses for the upcoming procedure and ongoing care. Explanation. This scenario presents a professional challenge because the financial counselor is faced with a client's misunderstanding of fundamental healthcare cost-sharing mechanisms, which directly impacts their ability to make informed financial decisions. The counselor must navigate the client's emotional distress and potential financial hardship while upholding ethical obligations to provide accurate and unbiased guidance. The core of the challenge lies in translating complex insurance terms into understandable concepts and ensuring the client grasps the implications for their personal budget and healthcare access. The correct approach prioritizes client education and empowerment. By clearly explaining the definitions and interplay of copayments, deductibles, and coinsurance, the counselor enables the client to understand their financial responsibilities. This aligns with the ethical principles of competence and diligence, ensuring the client receives accurate information to manage their healthcare expenses effectively. Furthermore, it upholds the principle of client autonomy by providing the necessary knowledge for the client to make their own informed decisions about their healthcare and financial planning. This approach is consistent with the Accredited Financial Counselor (AFC) standards, which emphasize providing comprehensive and understandable financial advice. An incorrect approach would involve dismissing the client's concerns or providing overly simplistic, potentially misleading explanations. For instance, simply stating that insurance covers most things without detailing the cost-sharing components fails to address the client's specific confusion and potential financial burden. This would be a failure of competence and diligence, as it does not equip the client with the necessary knowledge. Another incorrect approach would be to offer financial solutions that circumvent or misrepresent the insurance plan's terms, such as suggesting the client delay necessary care to avoid out-of-pocket costs without a thorough understanding of the medical implications. This could lead to worse health outcomes and financial penalties, violating the duty of care and potentially engaging in deceptive practices. Professionals should approach such situations by first actively listening to and validating the client's concerns. Then, they should break down complex insurance terms into clear, relatable language, using analogies if helpful. The focus should be on explaining the purpose and function of each cost-sharing element, copayment, deductible, coinsurance, and how they interact. It is crucial to review the client's specific insurance plan documents with them, highlighting the relevant figures and percentages. Finally, the counselor should help the client explore budgeting strategies that account for these out-of-pocket expenses and discuss potential resources for financial assistance if needed, always ensuring the advice is compliant with all applicable regulations and ethical standards. Question 18. Benchmark analysis indicates that healthcare organizations are increasingly adopting value-based care (VBC) models As an accredited financial counselor, AFC focused on healthcare, which process optimization approach best aligns with supporting these VBC initiatives and enhancing patient financial engagement. Option A. Developing financial counseling strategies that proactively identify and address patient behaviors impacting VBC metrics, such as adherence to preventative care and chronic disease management, and integrating this with patient education on cost-effective care options. Option B. Prioritizing the maximization of patient out-of-pocket payments without considering the impact on VBC metrics. Option C. Implementing financial counseling processes that are not integrated with clinical workflows or outcome tracking. Option D. Focusing solely on traditional fee-for-service financial counseling, ignoring the shift to VBC. The correct answer is C. Implementing financial counseling processes that are not integrated with clinical workflows or outcome tracking. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an accredited financial counselor, AFC, to navigate the complexities of value-based care, VBC models within the healthcare system, specifically focusing on process optimization. The core challenge lies in aligning financial counseling strategies with the evolving reimbursement structures that prioritize patient outcomes and quality over volume. This demands a deep understanding of how VBC impacts patient financial responsibility, provider revenue, and the overall financial health of healthcare organizations, all while adhering to the specific regulatory framework governing AFCs in the U.S. healthcare context. Correct approach analysis. The correct approach emphasizes a proactive and data-driven strategy to identify and implement process improvements that directly support VBC goals. This involves analyzing patient engagement in preventative care, adherence to treatment plans, and the reduction of avoidable healthcare utilization. By focusing on these metrics, the AFC can optimize financial counseling to help patients understand their role in achieving better health outcomes, which in turn reduces costs for both the patient and the provider. This aligns with the principles of VBC and demonstrates a commitment to patient well-being and efficient resource utilization, which are implicitly supported by regulations promoting patient financial literacy and responsible healthcare spending. Incorrect approaches analysis. One incorrect approach focuses solely on traditional fee-for-service financial counseling, ignoring the shift to VBC. This fails to acknowledge the fundamental change in how healthcare providers are reimbursed and how patient financial obligations are structured. Ethically and professionally, this approach is deficient as it does not equip patients with the knowledge to navigate VBC, potentially leading to unexpected financial burdens and suboptimal health outcomes, which contradicts the AFC's duty to provide comprehensive financial guidance. Another incorrect approach prioritizes maximizing patient out-of-pocket payments without considering the impact on VBC metrics. This is ethically problematic as it can disincentivize patients from seeking necessary care due to financial barriers, directly undermining the goals of VBC, which aim to improve health outcomes and reduce overall costs. Such a strategy could also be seen as misaligned with the spirit of regulations that encourage accessible and affordable healthcare. A third incorrect approach involves implementing financial counseling processes that are not integrated with clinical workflows or outcome tracking. This creates a disconnect between financial advice and the actual delivery of care, making it impossible to measure the financial counseling's contribution to VBC success. This lack of integration represents a failure in process optimization and a missed opportunity to demonstrate the value of financial counseling in a VBC environment, potentially violating professional standards that require evidence-based practice. Professional reasoning. Professionals should adopt a framework that begins with understanding the specific VBC model in play, its key performance indicators, KPI, and how patient financial behavior influences these KPIs. This understanding should then inform the development of financial counseling processes that are integrated with clinical care pathways. Regular data analysis and feedback loops are crucial to continuously refine these processes, ensuring they actively contribute to achieving VBC objectives and improving patient financial health and overall well-being. Question 19. Investigation of how an accredited financial counselor (AFC) can best optimize patient financial engagement within an accountable care organization framework, considering the organization's focus on cost containment and quality outcomes, while ensuring the patient's financial well-being and access to necessary care. Option A. Prioritize the ACO's financial performance metrics and shared savings opportunities above the patient's immediate financial capacity and access to care. Option B. Proactively educate patients on their financial responsibilities within the ACO, detailing potential out-of-pocket costs, available financial assistance programs, and the importance of adhering to care coordination plans to maximize benefits and minimize unexpected expenses. Option C. Focus exclusively on identifying the least expensive service providers for all recommended treatments, regardless of clinical appropriateness or potential long-term cost implications. Option D. Provide general financial planning advice that does not specifically address the unique cost structures and incentive models of accountable care organizations. The correct answer is B. Proactively educate patients on their financial responsibilities within the ACO, detailing potential out-of-pocket costs, available financial assistance programs, and the importance of adhering to care coordination plans to maximize benefits and minimize unexpected expenses. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an accredited financial counselor (AFC) to navigate the complex interplay between patient financial well-being and the operational and financial incentives of an accountable care organization, ACO. The AFC must balance the ACO's goal of cost containment and quality improvement with the individual patient's need for accessible and affordable healthcare services, ensuring that financial advice does not inadvertently steer patients away from necessary care due to cost concerns or create undue financial burden. The ACO model, driven by performance metrics and shared savings, can create subtle pressures that an AFC must be acutely aware of to maintain ethical and professional standards. Correct approach analysis. The correct approach emphasizes proactive patient engagement and education regarding their financial responsibilities within the ACO framework. This involves clearly explaining potential out-of-pocket costs, available financial assistance programs, and the importance of adhering to care coordination plans to maximize benefits and minimize unexpected expenses. This approach aligns with the AFC's ethical duty to act in the client's best interest, promoting financial literacy and empowering patients to make informed decisions about their health care. It also supports the ACO's objectives by fostering patient adherence to care plans, which can lead to better health outcomes and reduced overall costs, thereby contributing to the ACO's success without compromising patient welfare. This aligns with the principles of patient-centered care and financial stewardship expected of an AFC. Incorrect approaches analysis. One incorrect approach involves solely focusing on identifying the lowest cost service options without a comprehensive understanding of the patient's clinical needs or the ACO's care pathways. This could lead to recommending services that are not clinically appropriate or that may result in higher costs down the line due to suboptimal care, violating the duty to provide advice that is in the patient's best interest and potentially contravening ACO guidelines that emphasize coordinated care. Another incorrect approach is to prioritize the ACO's financial performance metrics over the patient's immediate financial capacity. This might involve pushing patients towards services that offer higher shared savings for the ACO, but impose significant financial strain on the patient, disregarding the AFC's fiduciary responsibility and ethical obligation to protect the patient's financial health. A third incorrect approach is to provide generic financial advice that does not account for the specific financial structures and incentives inherent in the ACO model. This could lead to advice that is not tailored to the patient's situation within the ACO, potentially causing confusion or leading to financial decisions that are disadvantageous in the context of their ACO participation. Professional reasoning. Professionals should adopt a patient-centered approach, beginning with a thorough assessment of the patient's financial situation, healthcare needs, and understanding of their ACO benefits. This should be followed by clear, transparent communication about potential costs, available resources, and the implications of different care choices within the ACO framework. The AFC must then collaboratively develop a financial plan that aligns with the patient's goals and the ACO's care coordination strategies, continuously monitoring and adjusting as needed. This process ensures that financial advice is both ethically sound and practically beneficial for the patient within the specific context of an accountable care organization. Question 20. What factors determine the effectiveness of financial counseling for individuals with varying levels of health literacy when addressing healthcare-related financial decisions? Option A. The counselor's ability to adapt communication strategies and financial information to the client's comprehension level, ensuring clarity and actionable advice. Option B. The client's willingness to accept financial advice without question, regardless of their comprehension. Option C. The counselor's use of advanced financial terminology to demonstrate expertise. Option D. The complexity of the financial products being discussed, irrespective of the client's understanding. The correct answer is A. The counselor's ability to adapt communication strategies and financial information to the client's comprehension level, ensuring clarity and actionable advice. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the accredited financial counselor (AFC) to navigate the complex interplay between a client's health status, their understanding of health-related financial information, and their ability to make sound financial decisions. The client's limited health literacy can lead to misinterpretations of insurance benefits, treatment costs, and long-term financial planning related to their health, potentially resulting in suboptimal financial outcomes and increased financial stress. The AFC must exercise careful judgment to ensure the client's financial advice is not only accurate, but also comprehensible and actionable given their specific health literacy level. Correct approach analysis. The correct approach emphasizes tailoring financial education and recommendations to the client's specific health literacy level. This involves using clear, simple language, visual aids, and patient-centered communication techniques to explain complex financial concepts related to healthcare. This aligns with the ethical duty of care and the principle of client best interest, ensuring that the client can understand and act upon the advice provided. Furthermore, it supports the AFC's role in empowering clients to make informed decisions, which is crucial in the healthcare finance context, where understanding is directly linked to health outcomes and financial well-being. This approach respects the client's autonomy by providing them with the necessary tools to engage effectively with their financial situation. Incorrect approaches analysis. One incorrect approach involves providing generic financial advice without assessing or addressing the client's health literacy. This fails to meet the client's specific needs and can lead to confusion, non-compliance with financial plans, and ultimately, poor financial outcomes. Ethically, this is a failure to act in the client's best interest and could be seen as a breach of professional competence if the AFC is unable to adapt their communication style. Another incorrect approach is to assume that because a client has a specific health condition, they automatically possess a high level of health literacy regarding its financial implications. This assumption can lead to overlooking potential communication barriers and delivering information that the client cannot fully grasp, thereby undermining the effectiveness of the financial counseling. This is a failure to conduct a thorough client assessment and can result in advice that is not truly personalized or beneficial. A third incorrect approach is to overwhelm the client with highly technical financial jargon and complex documents, believing that this demonstrates expertise. This not only ignores the client's health literacy, but also creates an intimidating and inaccessible environment, hindering their ability to engage with their finances. This approach is unprofessional and counterproductive, as it prioritizes the counselor's communication style over the client's comprehension and ability to act. Professional reasoning. Professionals should adopt a client-centered approach that prioritizes clear communication and comprehension. This involves an initial assessment of the client's health literacy, followed by the adaptation of financial information and recommendations to suit their understanding. Professionals should utilize plain language, provide opportunities for questions, and confirm understanding through teach-back methods. When dealing with clients in the healthcare context, it is imperative to recognize that health literacy is a significant determinant of their ability to manage healthcare-related finances effectively. The decision-making process should involve 1. Active listening to understand the client's concerns and current understanding. 2. Assessing health literacy through open-ended questions and observation of their responses. 3. Tailoring the delivery of financial information using appropriate language and tools. 4. Confirming comprehension and offering ongoing support.